Good evening, dear participants. We are very happy to welcome you to yet another session as part of the NHRDN Mind Matters initiative, which has been conceived and brought to you with the sole aim of promoting mental health awareness. Let me take you through a list of these organizations who have partnered with us and have actually helped bring this concept into reality. We are very thankful that you have opted to support this very noble cause. And over the week, we are somewhere midway in between the various offerings as part of the initiative, which we will speak about in the subsequent slides. The response has been overwhelming, to say the least, and we're very grateful for this. This is what we had planned as part of the entire week for the NHRDN Mind Matters initiative. As you will see, there is an entire range of offerings, right from general awareness on the topic to deep dive sessions. One of those deep dive sessions is what you have joined right now. The other topics that were dealt with were maybe considered uncomfortable by some of us, but very relevant and pertinent to be discussed in today's times. We have covered topics such as suicide and self-harm, gender and sexuality in the workplace, substance use at the workplace, and today we talk about depression and anxiety in the workplace. There is also something on eating disorders that we will do tomorrow. Apart from this, there are a lot of these practice sessions that we've tried to bring to you as part of how to improve your mental well-being by very small, simple tasks that you can do to calm yourself down when stressed. We also have a lot of stories of resilience and people who have been able to fight adversity. We urge you to tune into each of these sessions. We will share the registration link with you as part of the chat box on this platform. So having spoken about the various training sessions and webinars that are available as part of the Mind Matters initiative, we also have a special toolkit that we have been working closely with the organizations who have signed up to build their entire mental health policy and help them with their mental health awareness journey. How to actually communicate to team members if they require help with drafting a mental health policy, in case they require help with an employee assistance program. All of this has been woven into the toolkit, and also a very unique Mind Matters Ambassador certification, which we completed a day ago. And there were very select few representatives from organizations who were chosen to be a part of this program. There are also free LinkedIn courses, as you will see on this list here, and a few more which we have added. Information pertaining to this is available on our website, NHRDN website, which is available. We will share the URL with you as well. The Mind Matters page at nationalhrd.org. Click through any of these links. They're available at no additional cost to any of you who might be keen to avail of it. A few quick ground rules before we begin. We will keep your lines muted to ensure that we don't get too many interruptions during the session. In case you have a question, either use the question box on the platform to write in, and we will respond to those in course of the session or towards the end. Alternatively, you could raise your hand and we will unmute you at the end of the session. We will share a feedback form with you. It's very important that you share your thoughts on the program and how you found the entire session for us to be able to improve our offerings to you. And most importantly, do tag us and tweet and help spread the word on social media. Our handle and the hashtag is what is up there on your screens. Do ensure that you help spread the word. We rely on you hugely to help us with this. Coming to today's session, it is our privilege to have amongst us two very, I would say, authorities in this field, along with Devika ji, Devika Dharmraj is the moderator for today's session. And to give you a very quick overview of all the value that Devika ji brings to the table, she is an XLRI pass out, the 1992 batch, has 28 years of experience across sectors in HR, including working with a non-profit organization. She's currently partner director at Kelsa Solutions, and she is an accredited instructor in mental health first aid, as well as an accredited HR competency assessor. Over to you, Devika ji, to take forward the session with Danesh and Titus.
Thank you, Nisha. I want to set a little context to today's discussion first before I introduce our panelists. I think that the pandemic, this COVID pandemic, has put a spotlight on this mental health crisis in a very new and immediate way. We can't ignore it. And the stress and the anxiety and the uncertainty of this time is not only raising awareness, but it's pushing us as a society, I think, to have honest conversations, right? That we always needed to have about mental health, especially when it comes to taking action. Some factoids about anxiety and depression. Anxiety can be crippling. It can create severe disability. Up to 33% or more of the population are affected by an anxiety disorder during their lifetime. Okay, this is from the WHO data. Yeah? Most prevalent classes. This is the most prevalent class of mental health disorders, anxiety. Yeah? Depression, apparently, and this is scary. So this Mind Matters Week, I'm seeing that we have an opportunity. And as this pandemic sort of accelerates the mental health crisis that already existed, we should be taking steps to really course correcting in ways that we desperately need to. Right? There are two key developments I find that make this opportunity possible. Number one, the pandemic has exposed unsustainable ways of working and living. Right? That most of us are in this like boundaryless perma work, working from home. It's parenting has become like an all-around the clock job. First responders are risking their lives at the front line. Yeah. So first of all, that is like come to the front. Secondly, I think we now have the science to help us identify signs, stressors, solutions. And today we know more than we ever did before about the brain's connection to our mental health and how we manage stress. Yeah. To help us to understand these areas of anxiety and depression a little better in the workplace, we have with us a couple of very eminent people. I'd now love to introduce them to you. Danesh Umrigar is a clinical psychologist. He works mostly with adults on a range of mental health and emotional well-being concerns. Okay? He's got significant experience with neuropsychological and psychological tests. Works in the areas of anxiety, depression, sexuality, behavior medicine. Danesh has an MPhil in clinical psychology, and he has in the past been, I think this is not his first public appearance by any means. He's been building mental health awareness through radio. He's also faculty at the Pune University. And to have this like double barrel panel, we have Titus Joseph, who is a counseling psychologist, also from Pune. I think Titus, you work mostly with young adults from what I hear. Again, mostly related to depression and anxiety. In his work, he uses a range of CBT approach and recovery-oriented approaches. Yeah? Worked very closely with implementation of projects that were aimed at reducing stigma and improving access to mental health services in rural India, especially in Gujarat. Titus is from TIS, and went on to finish a PG in human rights, mental health and law from the Indian Law Society. So like we have like a heavy duty panel, and I welcome you both. Thank you both very much for giving us time. Today we have I think we have an audience that is very keen. This is a subject that resonates really closely with most people, right? It's either for yourself or somebody near close to you that you want to know about a little more about the subject for. So before we get into the nitty-gritty of it, uh, could we understand from each of you, and maybe I'll start with Danesh. Danesh, could you talk about there is a difference between anxiety and depression. So just for the sake of our audience, if you could just say what is anxiety, what is depression, and if you could talk about the anxiety part of it, I'll move to Titus for the depression part of it, and just to say what is it, the difference
Sure.
between the two.
Sure. All right. So if you're looking at anxiety, okay, when you're looking at anxiety as a disorder, when it comes to being a diagnosable disorder, it's very different from your normal senses of worry or fear that you generally have. Normal worry, fear, even anxiety is quite, we all feel it in our day-to-day lives. But the difference is that when it becomes way too much, when it starts to affect your functioning, when it starts to affect how you interact with yourself, the world, family, everything, then it starts to become a problem. Now, I guess that if you look at that as its basis, it'll help us to understand the difference between maybe normal stressors, normal worries, and the level that anxiety as a whole diagnosis brings about. Anxiety is what? It's not just.
Oh dear, I think Danesh is frozen. Titus, would you like to pick that up?
Yeah, sure. I think a part of what Danesh was talking about was the difference between regular stressors and anxiety. And I think he's absolutely on point. I think there is a difference between everyday stress and anxiety that really makes us unable to do things in our everyday lives. Just to give like a metaphor, if we have these experiences very regularly where we're walking down the road and suddenly there's a lot of dogs on the road, and we're usually very okay with them being around, but suddenly out of the blue one of them starts barking and you're going to be like, oh, you're gonna get a little freaked out, right? You're going to walk maybe just a minute ahead, and you're going to calm down, and then you're going to go on with your life. But when it comes with anxiety as a disorder, I think the difference is that when you keep walking and all you're thinking about is that dog, and you're not able to maybe sit on a bench without thinking about it. You're not able to kind of move ahead, and walk into that park thinking about it. It's going to be there all the time, and that creates a lot of stress, and it's kind of pervasive, and that's what anxiety is about.
Okay,
Sorry,
so the
Danesh.
word I'm hearing from you, what I'm picking up is pervasive,
No.
that it affects everything that you are doing and saying and influences your the way you think and your moods and your behavior, and that's when it becomes a problem. Is that what you're saying?
Yeah, absolutely. And Danish, I was just talking about how it is pervasive, and we just lost you. So maybe you can continue on the rest of it. Yeah.
All right. I think I heard exactly what you were saying. So I think you covered everything that we were going to. But
Yeah.
yes, you're right about the pervasive nature of it, that it's more than not. And then because of which there are impairments in functioning. I'm unable to actually function very normally. I'm unable to have a healthy, maybe relationships, unable to work properly, unable to actually function in my day-to-day life. So these
So could we talk
issues
about
actually.
some of the, how do we recognize this? Could we talk about some of the, how does it manifest? How do you know that somebody is anxious? How do I know that what I'm feeling is anxiety?
Okay, so again, if you're looking at the pervasiveness of it, where does it stop? Is it something that is just can help me to work? Am I able to work along with it? Is it fine, or does it push me to an extent where I am truly unable to function? Now, again, if you're looking at symptomatology and all that, we have to understand that a lot of these things are very internal. There is no face to anxiety. There's no face to depression. You can't look at a person and then say, hey, you know what, you have anxiety or you got depression. I think we have to understand that a lot of what happens is on the inside. And we tend to not really show all of that to the outside world. It's like a mask which we always wear. You know, how simple is it for you to smile? When you're having a bad day, and let's say somebody else comes next to you, how easy is it for you to put a big smile and say, hey, you know what, I'm doing fine, thank you. Yet, there could be a storm brewing on the inside. So a lot of times we have to understand what are the internal sensations, what actually happens within. And I think that is what is more important here too. So
Thank you. Yeah.
there can be two kinds of symptoms. There can be a physiological symptoms, which is what I have is bodily sensations in anxiety. You could have your heart can continuously racing all the time. When I'm in certain situations, I suddenly feel very tense, very odd, very off. I don't really feel very great. I feel like my heart is racing. Maybe I feel that, that sometimes I feel like,
So here,
okay,
I'd like you to, sorry, just want to just differentiate here between a good, healthy level of anxiety and when does it cross that line? Because sometimes it's good to be a little bit anxious about something, right? Your adrenaline pumps and you do the best you can in situations. That's what helps you to do the best you can in situations. So, where is there a line?
I guess, yes, there is, when again it starts to affect functioning. You're right when you're talking about the levels of stress and functionality. I think we have to think of it as a bell-shaped curve. There is an ideal point between the high levels of stress and performance, where I reach a point of optimal performance and optimal stress, after which there is going to be a downslide.
Thank you. And this differs from person to person, isn't it? It's not one size fits all.
Yes. It is not.
Okay,
it is not.
great.
It differs from person to person. Some people can handle a lot of stressors, may not show visibly any other signs. Some people may not be able to. Now, this again, please understand here, this is not a sign of weakness. It does not show that, hey, if I cannot handle stressors, there's something wrong with me. No, not at all. We usually, when we're looking at people, we always look at, the large stressors. Oh, you know what, you have a job interview coming up, you have an examination coming about. Nobody looks at these smaller things which have a cumulative effect in the entire situation.
Bucket is full and it overflows with just that one little bit.
Absolutely. The closer my bucket is, the water is to the top, the more likelihood that it will actually overflow.
Spill over, yeah. Thank you. Yeah. Shall we also now try and understand a little bit about depression so that, when we go forward in the discussion, we are clear about what is anxiety and what is depression and what we are talking about when we refer to both of them. Titus, would you like to help us to understand depression a little better? What's the difference between sadness and depression, for example, to start with?
Yeah. So before I start, I just want to kind of repeat a few of the things. One is that the experience of depression and anxiety, as you rightly said, Devika, is very different for every person. And while we may be right now kind of compartmentalizing and talking about each of these symptoms, it's important to know that each person experiences it differently. And the second bit is that anxiety and depression are very closely linked. We can try and today to create a differentiation here, but they're very closely linked, and some of those features and symptoms very much overlap. Right? So when it comes to depression, I think very often the very basic things of there are a few things that stands out. Depression physiologically affects sleep. You were either finding it very difficult to kind of you fall asleep at all, or finding it very difficult to get up. The other physiological aspect of it is about appetite, where you either don't feel like eating at all, or you end up eating too much because of what's going on and the inner turmoil that Danish was talking about. There is the other major differentiating factor about depression is that depression is primarily very much linked to a feeling of helplessness, hopelessness, and low mood. It's the kind of that feeling where you don't have the motivation to do anything. You want to, there are lots of things out there that you really do enjoy, but not being able to find that joy and happiness in doing that. Very often, if you were to put it in the language that people describe it in, people usually talk about it as like a gray cloud over my head. Like there is so many things in my life, but everything is kind of clouded by this gray cloud over my head. That's kind of some of the expressions people use to describe it.
So are you saying that if somebody is in depression, they will not experience feelings of anger and the stronger emotions? Is everything tamped down then for a person who's in depression?
No, that's no, absolutely not. Because I think, like I said, that's why I started out with that caveat is that every person experiences depression very differently, and there may be people who might not be able to, when they are in a low mood, may not be able to talk or don't want to engage with conversations. But there is a very likelihood that depression expresses itself in terms of anger. Very often, actually, when people are depressed and cannot express what they are feeling, it sometimes comes out as anger and frustration, right? You feel low about something that happened at work, and sometimes you end up, yelling at your children because of it. You might be feeling sad and low, but the reaction to it would be something else. So it's hard to say that you don't get angry. You will feel all of those emotions like every other human being, but the way we process it at that moment is slightly different.
So it's not so easy to compartmentalize and say this is anxiety and this is depression, right? That's what I'm understanding now from our conversation.
If you look at it from a diagnostic level, yes, you can, but there are interactions between the two of them. Now, even if you look at it, anxiety and depression, they are separate from each other, but there are also linkages. We do tend to see that a lot of, not in a few people, that anxiety may occur with depression, and a person with depression might also show certain symptomatology of anxiety. At a biological level, they could be very, very similar in terms of neurotransmitters and certain chemicals. So again, when you're looking at it, though they are separate entities, there is an interaction effect. There definitely is an overlap.
Yeah. So would you say that biology and genetics play a big part in this, in manifestation of anxiety and depression in people? Is it, can biology and genetics determine whether it will be more for some than others?
I don't think it can be a very direct question. I mean, a direct answer there saying that, okay, if someone is there in your family, you will get it. It definitely does not
So there is a
that.
component.
Yes, there are genetic linkages. However, it cannot be 100%. You cannot say that just because you have it or my parents have it, I will get it. There is no 100% there.
So
That
what is it that triggers um, episodes of anxiety or triggers episodes of depression in people?
again,
Does
I
there
think
always have to be a trigger?
not necessarily. Not always necessary. Sometimes we have to understand that trigger is not in your face. It's not just there. It's not something which is obvious. Sometimes it could be many, 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 many little situations coming together, which could cause a person to feel a certain. Like you said, if you're looking at, okay, let's look at depression, anxiety as two separate things. Depression, a person is usually maybe thinking about the past, worried about how things have been or what has occurred. Anxiety is going to be more fear-based, more things about the future. Those are also going to be big differences.
Titus, what have your experiences been with?
Yeah, so just to respond to that question on, what are the triggers? I absolutely right, Danish. I think, it's difficult to, again, pinpoint any particular trigger because triggers are different for different people. But I think a few things that we can recognize is that there are very strong environmental and social factors that affect, anxiety and depression at a social level. I think some basic things like poverty, need for security, safety issues are very much things that put people at risk for depression and anxiety. And like Danish was talking about, genetics is one small part of it. And genetics, when it interacts with the psychological and sociological aspects of our life, would then increase chances. And if you say, for example, if your parent has depression, like Danish said, it's not necessarily the child would, but if the child also grows up in a very vulnerable environment and has an environment that's unsafe, has an environment that's at risk for probably abuse or for that matter any other safety related issue, you are at a higher risk. And still, there are people that are resilient and come through it, and maybe it still doesn't end up with them having depression, but you definitely are at a higher risk of having depression and anxiety when all of these components come together.
Okay, so just so that I've understood what you're saying there is, yes, genetics plays some part in it, but not all. There is some biology also in terms of how my body structure is and the chemicals work in my body. You're saying the impact of my environment and events that have happened to me through my life also has is there anything else that we need to think about?
You sound a little
Think of it like a biopsychosocial approach. Three things. Yeah,
Okay.
think of it like this
everything,
biopsychosocial
basically.
approach. I think that is.
Yeah, and I'll just draw a parallel. I sometimes when we give this answer, I think like, what is it? Like everybody has this question, like, what really is it that, tell me that one cause so that we can kind of figure it out, right?
Right.
But unfortunately, it's the same for, say, hypertension, right? People have BP. There's a biological kind of framework, but why it happens, and the lifestyle-related challenges that it's linked to, it's multiple. And you don't have that exact mapping even for something like depression and anxiety, and that's unfortunate, but that's the reality of it.
Okay, I'm glad you said that because I think it's important for us to understand that anxiety as well as depression are illnesses like diabetes and blood pressure. And they are medical uh, uh, illnesses that can be treated as easily as high blood pressure or diabetes. In terms of what people are afraid, right, to come to a therapist or come to a counselor, come to a psychiatrist about for a mental health related thing, because there's this huge stigma around. Right?
Yeah,
but if people understand that it is as common as and as relatable as having high blood pressure, like you said, I think it would be a little easier for me to step up and reach out for help.
yeah.
So thanks for mentioning that. So bringing it to the workplace now, have you, as mental health professionals, have you all seen many cases of anxiety, depression in working adults? And has this been increasing over the years? Do you have some sort of with the experience that you've had working with these people, have you had some inkling of what could be causing it? Why is it increasing? If it is increasing.
Sure. Danish, you want to go first, or should I start off?
Go ahead. You can start.
Sure. So I think just responding to the question, I think workplace is just like any other community. So people do experience depression, anxiety as an interaction with any community that they have. So yes, people do experience depression and anxiety a lot in workplaces, as they would when they were to interact with any other community. And in my experience, some of the kind of issues that kind of come up that kind of affect people's depression and anxiety is sometimes very basic stuff. Sometimes it's some basic stuff like complicated work schedules, right? Not being able to get enough sleep. Sometimes it's relational. Sometimes it's related to having difficult conversations or having difficult relationships within the workspace, which sometimes, because of power structures and because of the way we design our organizations, have an impact on the way we are able to express and have an impact on the way we are about to speak up about certain things. So those are some of the kind of issues that people talk about when they are talking about mental health and their mental health in the workspace. But there are plenty of other things that also people speak about. But yeah, Danish, if you want to add to that, go ahead, please feel free.
If you could help us understand,
sure. I guess even
or Danish, with your response, if you could help us understand a little more, what organizations should be doing really what areas should they be looking at, because those are areas that are impacting people.
I want to just add before that to what Tax was saying. Lifestyle as well has changed. Stress levels have also changed over the last couple of years. I guess the amount of resources that are there, the free spaces at work, and the amount of workforce, even that does add to the stress. there is work stress, there are deadlines, there are financial stresses, there are, the job stresses as well. Am I going to actually have my job by the end of this month? These are all complications that actually are also there. I guess when we're looking out for what in the organizations can do, it's a lot of actually maybe even about working more towards understanding what it is, understanding about what things could be happening. Like, for example, as simple as this, what about a work-life balance? Can an organization maybe have some kind of a work-life balance? Is there a possibility to say that, okay, you know what, you're working from X time to Y time. During your work, during these times you're at work, after that, maybe not. When you are, let's say you're on your break, or let's say you're on holiday, or your Saturdays and Sundays, if you have Saturdays and Sundays free, is it possible to actually not contact for that? Is it possible, even again with work from home, where are the timings? When you were at office, you would go to work at 9 a.m. You would sign out, let's say, at 5:36. When you're at work, when you're at home, especially now during the pandemic time, you're working from 9 a.m., but it may stretch all the way till 9 p.m. or 10 p.m. as well, because there is no line there to differentiate between when a person should stop. There are deadlines which have to be met, so you have to do it. Anecdotally, if you look at it, a lot of people who we are actually seeing, a lot of them complain about that a lot of people start saying that, hey, you're just at work, you're at home, right? What have you got to do? You've got all the time in the world. Why don't you just take this on also? It's a small thing, just take this on, come on. But you see, when we were talking about the small things which keep adding up, we are not seeing that by working at home, you're also in that same environment the whole day. You're not really stepping out. You have to work, you have to look after your family. Let's look at working women, working mothers. There's so much that has to be done, the roles that people have to play. You have to work, keeping the house clean, with the pandemic especially. You become everything, and there is no other help. So therefore, the stressors tend to increase.
They talk about this thing called decision fatigue as well, isn't it?
Sorry?
They talk about decision fatigue.
Decision fatigue, yeah.
Decision fatigue.
Yeah.
Which is very, very common for people who multitask, like you're saying just now, between home and work and many other responsibilities. Yeah.
Because none of us have really been in this situation. We don't know how to. We've all been just thrust into this situation where now I have to do everything. And sometimes we don't notice how even they may seem like small tasks, but they're actually things that everyone has to do. And they are taking away energy. They are draining you. They are things that you are working on, which means there is that much less energy to work out of as well.
So what can organizations do then to support people who are going through these issues? Because it appears to me the statistics said 42 or 43% before the pandemic, right, of people at the workplace are suffering from fairly high levels of anxiety. And they sort of clubbed anxiety and depression and said 42.5%. Post now during the pandemic and after, I don't know how high that percentage would be, right? So what can organizations do, especially when they're working, everybody's working remotely, right? So what can they do to support people in this whole virtual environment?
Okay, I think okay, maybe I'll split that question into a couple of parts and try to answer that. I think there are a lot of things organizations can do because I firmly believe that, you know, work is a huge part of our life, right? We thrive on work. Many of us make work our identity, and therefore the opportunities that your workplace has to make life easier, make life better for people with mental health problems is enormous, right? You know, having said that, I think the first thing I feel like organizations can do is promote mental health. And by promote, there are two things. One is this is a form of promotion. We talk about mental health, we kind of have conversations, help people understand, build awareness, build empathy towards people who are experiencing things. But the other part of promotion is kind of looking at basic things. And I think Ganesh touched upon this a little bit, is, ensuring that there are, something as simple as ensuring that there is a fair wage, something as simple as, you're timely compensated, something as simple as, checks come in on time and it's not delayed because people are struggling right now. Promotion is actually, promotional mental health issues are not just, something that affects people with mental health issues, but it's good for everyone, right? Ensuring that the workplace is safe. And I don't know how we would have to imagine that, in a pandemic hit kind of situation. Usually workplaces have the control over ensuring that offices, work plants and things are safe. But now people are in environments that are unpredictable, right? Is there anything that we can bring in to make people feel more safe? Whether it's clear communication about their safety at home, whether it is clear information on how to get out of a dangerous situation if they're at home, right? So I think taking care of some of the basic things is what organizations are already doing. And the one thing I wanted to mention here is that before we think about what we can do, I think it's important to acknowledge that some of the things that we already do promote mental health. And can we expand on that? Can we expand on some basic things that we provide for people within their work structure that will help them just thrive at work, and that improves mental health? And the other bit is about the prevention. So promotion and prevention are slightly different. So prevention is to ensure that there is some level of input that the organization puts in that avoid certain risks or avoid certain circumstances that people may encounter at work. For example, if like the a situation that I mentioned, if work relationships are conflicted, right? That adds a lot of stress. And are there skills that we can equip our managers, our peers with that? And conflict management is one of those things that we regularly hear in a lot of organizations. But can we look at it through the lens of mental health? Can we look at conflict management as a tool to prevent mental health issues? Is there a way to look at those things through the lens of mental health? Another simple example is things like mentor support programs, which a lot of organizations do, which acts as like a preventive mechanism. So very often mentors are people you can open up to without having to talk about the burden of work and kind of get information from. And a lot of organizations already do this, but is there a way to strengthen these mentor support programs and add in a component of mental health within those already existing programs that will help people open up, talk, have spaces to communicate and communicate freely? I think those kind of steps really would help people in organizations.
So I think there are organizations which may not have been doing this very seriously in the past, would probably want to start doing it more seriously now, given the situation and given the awareness that hopefully everybody is starting to open their minds to now. So I'm just wondering how in this virtual time they would impart these skills to people. It's a little hard, isn't it? Do you have any ideas for them, for organizations?
Okay.
Again, I see like what Titus was sort of saying. Sorry, Titus, sorry, go ahead.
No. Go ahead.
I just want to add one more thing. Yeah, just adding one more thing to what Titus was saying, right? Making the managers, making your colleagues a part of a solution. Making everybody a part of a solution. Not usually what happens when we find somebody going through a mental health crisis, we usually tend to give them a lot of gyan. Have you tried this? Have you done that? Oh, did you do this? And I think that also can take away from the whole experience. Let's not put all the responsibility on the individual who's going through the crisis. Can we make ourselves part of the solution too? Can we ask, okay, what can I do? How can I help? Is there something that we could do to actually make it maybe easier? Again, with HR and everything, are there certain kind of these policies that accommodations or so that a person who's suffering from a mental health concern Are there certain policies that can be drafted up for companies which help or make it easier for a person with a mental health issue to be able to work in an organization as well, and making those openly accessible? And I guess, again, that also stems from maybe a reduction in the stigma. Am I able to go out and tell my manager, you know what, I don't think I've been feeling great for a long time. These are the things that have been affecting me. Is it that simple, or am I afraid that there's going to be a backlash from there saying, you know what, no, I just think you're lazy. I don't think
So
you're doing
you're
well
talking
enough.
about really the whole organization having a culture of openness and a lack of fear of repercussion, really, isn't it? That by opening up or by talking about something that does not suit me in this organization, I'm not being seen as bad mouthing it, but being seen as trying to improve what there is. That really is the atmosphere that we're looking to build in organizations.
Yeah,
Isn't it?
That's right. That's right.
Could we give people some indicators, just some small ideas of how to manage their own, you know, anxieties and triggers or stressors? What can you tell people about how to manage anxiety?
Yeah.
Titus?
Open question. Sure.
That's
I
right.
think again, I think when it comes to managing depression, anxiety as a general picture, there are few basic things that anybody can do, and I think some of those things that's not specifically for depression, anxiety, but applies to our general health. Ensuring that there is a schedule, ensuring that you have a general schedule of when you do things and when you go to sleep and when you wake up.
A routine.
Those are a basic routine, and this is specifically for people who are experiencing symptoms of depression, anxiety. And having a time for those things, I think, generally helps everyone, but also adds on to the effect that it has when somebody's going through depression, anxiety. Exercise, I think sometimes you undervalue the effect of exercise. Exercise helps us generally in health, but a lot of clinical research studies have shown that very often exercise works just as much as therapy in a lot of situations, because of the effect it has on our body and our motivation and our general well-being, right? So I think these are general things that people can adopt. Ensuring that you have basic nutrition, ensuring that you're eating on time. See, these are some of the basic things that you can do to just generally improve your health. But fortunately, and really, it's amazing that those basic things actually also improve basic things like depression and anxiety. And those are some of the initial things that we can definitely look at. But yeah, there are, I mean, I see it as a kind of a pyramid, right? At the base, the most things that we can do is to encourage a lot of self-care activities, and exercise, sleep, routine are basic self-care activities that you can encourage in people. And I think the other bit of this is to encourage very informal support mechanisms. People who are experiencing anxiety and depression, it would be really good if they did have people that they trust, that they can reach out to have a chat, to kind of just you have a basic problem. I'm not able to figure out how to make this presentation properly. I think I'm gonna lose my job, right? That's the jump we usually make. And sometimes just talking to a peer can help us think through some of those problems, figure out what's the solution, what exactly is the problem. So having, again, going back to what Danesh was saying, spaces where we can problem solve, spaces where you can reach out and ask people questions to get basic answers. Those are some of the general things that people can engage.
So it's probably important for people to maintain connections and networks more than ever now, isn't it? Because for example, if I'm going through this and I'm not reaching out to somebody, but if somebody calls me and says, "How are you doing, Devika? Are you okay?" then it gives me an opening to talk about it.
Right.
That's also true. That is definitely true. So it's also about being able to reach out for sure. But along with that, it's also about me being able to understand my own emotions. Pay attention to what those emotions are, pay attention to what those feelings are. A lot of times, do you notice that we tend to avoid certain situations? We don't pay attention to a feeling, we just avoid it without thinking, without
I don't pick
wondering
up the
why.
phone. If somebody that
Exactly. My boss is calling.
asked me for something and I've not delivered it, calls me, I won't pick up the phone.
Absolutely. But that avoidance isn't really working on a solution. Avoidance isn't actually helping me to understand
It
what
just
the
builds the
issue
stress even
is
further. Yeah.
and what the issue is, right? I have to understand that something is happening that is giving rise to a feeling. And then that feeling is giving rise to a certain kind of behavior. So understand that feeling. Sometimes questioning, like what is making me feel this way? Like Titus was saying, right? I'm making a presentation. I really don't know what's going to happen. Let me take my own example. Okay, I'm nervous. This is something which is big. I don't know. Will I be able to do things? These are questions which come into all our heads. So if I understand what is making me feel that way, it gives me a better way to be able to work towards a solution of that. I can easily say, let me just avoid this meeting. Hey, I'm sorry, I have not really felt that well, so I won't be able to attend this meeting. But that avoidance behavior is still keeping the problem right there.
Right.
So questioning what is making me anxious? What are the thoughts that are coming about? What are those fears? How probable are the feared outcomes that could be there? Questioning, is there something alternative that could go?
I can probably ask myself these questions if I'm at a certain level there is a certain level of coherence in my head, right? But if I'm at a stage where I'm so bogged down that I'm not able to think straight, yeah, then what do I do?
Isn't that a time when maybe we need to question and say, is this that something that is actually affecting my life? Do I need to seek help? And I think we will be building up to this whole thing about seeking help. The ability to be able to say that, hey, I need help. I
Yes,
think is
because
one of
it
the
can be a
biggest
very
things.
scary, it can be a really lonely and really scary place to be. To think that there is so much darkness inside, and I just don't see a way out, and I don't see any light at the end of the tunnel. And I think it's just easier to just sink down into this and stay in that darkness.
I was having a conversation
Both
with
of those things.
someone and they put it across as this, the depression, the anxiety makes you focus on the dark. Is it possible to be able to make a person or help a person to focus on the light? Again, how can I do this? Again, therapy, help, any kind of help, even sometimes as simple as being able to talk to somebody else, being able to be vulnerable to somebody else, with somebody else, opening up about situations, opening about what is happening to me, what I feel, how it's affecting me. We are
So
so
what are the
scared
things
about.
what are the things we should be looking out for? If I can't get out of bed in the morning, for example, right? I believe that is a very classic symptom. I don't want to get out of bed. I don't want to brush my teeth. I don't want to do anything. I just want to lie there. And it's not one day, it's day after day. So are there other things like that that we should be cognizant of?
So we are also here when we're looking at it, we're looking at the one of the extremes. I want to go back to maybe the very normal things that people may experience every day as well. It need not be that I can't get out of bed. I'll get out of bed, I'll still go to work, but every task that I do is going to make me feel tired. It's going to drain me out. It's not there anymore. I don't feel it. Like Titus was saying, this dark cloud over me no matter what I do. I'm functioning well. My office may not even know that I'm going through something, but inside there is this storm brewing.
So it's important to know that this is not okay and that I need to reach out.
And I am not weak. I think here we've associated strength with a lack of feeling a certain way. We've
Right.
we've divided, emotions, the good, the positive emotions, the negative emotions. We've divided so many of them rather than seeing emotions, as a whole, which make us as humans who we are. Oh, you're feeling sad? You are a sad person. Oh, you felt angry? You are this angry person. So we're not seeing an emotion as just an event. We are defining ourselves sometimes by that emotion, which further makes us feel lower and worse about ourselves.
So
Imagine a
labeling
space where I
is something, is a trap that we all fall into, isn't it? It's so easy to
we've been
label
taught.
people.
Yeah.
Lazy, I think, is the
Absolutely.
biggest label, don't you think?
Yes.
Yeah.
Lazy is the biggest label that we all give. I'm sorry, Dykes, I'm here. Go
Go
ahead.
ahead. Yeah. No, I was just going to add to that question that you were asking, Devika, about. So, if you are experiencing some of this, and say if it's as the thing is you're continuing to work and you're still feeling that dark cloud over your head, I think the first question that yeah, I mean, the first statement that you can actually tell yourself, which sometimes a lot of clients find as a relief, is that, hey, I am feeling sad, okay, and it's okay to feel sad, okay. I think that the first, I think that's the, as a therapist, I think very often that's the first thing I do. I validate, and sometimes self-validation can actually open doors for you, right? I'm feeling sad, and that's okay, right? Then opens up opportunities for you to say, okay, if that's okay, then I can actually figure out how to not be sad. If it's okay, then I can actually talk to someone about
So you're
being
giving
sad.
yourself permission to really.
Absolutely, I think, and that permission is very often liberating, and it's kind of like a box that kind of opens up the moment you permit yourself to say, yeah, listen, I'm not the strong person that I thought I was. I am sad right now. I have been feeling sad for a week, and that's absolutely okay, because we are humans and
So
we
tell
do
me,
feel emotions.
when and why would one require the medication and or therapy?
Okay. So before I answer that question, I just want to put things into a spectrum, so that we don't jump. Very often when we think about depression, anxiety, and uses clinical terms, we're like, okay, there is something wrong. We need help,
Yeah,
and you need to go to someone to take care of it, right?
that's
But
right.
very,
Yeah.
it's a spectrum, right? You start with things that you can actually take care of yourself. I've been having trouble at work for a week. I've been bogged down by work. I can do basic things. Take 2 days off. I can, go for a break. I can watch something. I can, take care of my health. Basic things that you take care of yourself. And after you do that and you realize, okay, I've done all of this. I've, put my health back into this thing. I've, figured out my sleep, and still I'm feeling this way, right? You can start asking for help, and help doesn't immediately have to be a psychiatrist or a counselor. It can be a friend or a peer. You go and say, listen, I tried all of these things, and I've not been able to do it. Can you just think through this with me? And you get that help from a friend, and sometimes that help works, and you're like, oh, I really didn't think of that. I should try that, and maybe I should. And for some people
Mhm.
at that level, it kind of takes care of itself. And when you've tried that and you've accessed help and you're still not able to kind of manage it, and it's still kind of getting worse, I think another 5 days, another 6 days, you're kind of still struggling with those same emotions. I think for me, that's an indicator where you need to now look for professional help. And that can be a psychologist or a psychiatrist or any other person. And I think we need to see it that way. It's not that if you feel depressed, you need to immediately get help, but there are different things on the spectrum that you can do to get help.
Exactly. Let's
So,
not, again, it's like when you see the pressure on your tire on your car down, do you wait until it's completely flat, or do you take preventive action right there? Let's not wait until it blows up. If you're noticing that there are changes with it, see, ask. It doesn't, again, like Titus was saying, it doesn't have to be a doctor. It doesn't have to be a therapist. Talk to someone. Allow those to actually allow the feelings to actually be open. If you find that thoughts are persistent, it's hard to work, it's difficult to focus, I can't concentrate, it's difficult to manage activities, or it's becoming difficult to manage activities. Am I withdrawing myself from people? Am I withdrawing myself from activities? Am I turning to drugs, alcohol, or any other form of risky behavior for comfort?
so you're
Well,
asking
what
for
are
a
my coping
certain level of
strategies?
self-awareness there,
Yes.
isn't
Which
it? You're
we
asking for a certain
never.
level of being aware of what I'm doing, stepping outside of what I'm doing and looking at it.
I guess we all are aware of it, but we tend to keep telling ourselves, maybe there's nothing wrong. I can deal with it. We've been taught this as well, to look at, hey, you can manage things. Don't worry, you're strong. As a strong person, you can deal with it. Because you're strong, you can manage. But there's also this thing about, when you look at mental health concerns, it's always seen as something which, well, if you're strong enough and if you've managed everything yet, then it's not going to happen to you.
So I want to build on something that Titus said a little earlier, which is basically the role that friends and family play, right? In this, that we can use that support network of friends and family to reach out to. What role do at work our managers and peers play? What can they do?
Okay, I'll start off and then Danish, you can add in. I think one of the basic, I think I'm repeating myself sometimes, I think the best thing to have available is a space to, listen. And I think managers and peers, very often we do get caught up and we have our own things that are kind of going on in our lives. But, and we're worried, very often we're worried that, it's just an excuse, right? They're just doing something to kind of, maybe get attention. They're doing something because they're lazy, and these are a lot of those stigmatizing thoughts that kind of go on in our head. And I think when people are asking for help, very rarely are people lazy, right? They've usually reached the end of their tether, and then they're asking you for help. It takes a lot of courage to kind of say, hey, listen, I've been going through something really difficult. And I think, just acknowledging that first, validating it, and giving that open space to talk without feeling the pressure of wanting to solve everything. Just because a colleague comes and says that they're feeling upset doesn't mean you have to solve everything for them. And I think as managers and as peers, if you just give the space to listen, that goes a long way in helping people open up and actually very often figuring out solutions for themselves. But just creating that space, I think, is one very important thing that managers and peers can do.
Okay.
It's also about support rather than helping the person out. It's not that I have to jump in with them and carry them on my back and bring them out. I don't think anybody here really wants that. So as friends, as managers, as anyone, what can we do? We can educate ourselves. We can learn about things. It's very simple for us to just label. And like we're talking about labels, the simplest example I like to give is lazy. Lazy versus a lack of interest. Lazy versus a lack of motivation. Lazy versus decrease in energy. All of these three could be seen in the same way, but it's so simple for all of us to even self-label ourselves as, I'm lazy. Oh, I had to do this. I couldn't. I'm lazy. Or you've not completed your work. You're lazy. Educating yourself on what else it could be. You're right. Create a safe space somewhere where I can actually open up and I would not be judged. I could be validated for the feelings that I have and not invalidated for coming up and opening up. It is one of the toughest things to do, to actually open up and say, hey, this is what I'm going through. This is a fear. So let's be
So are we able to provide that safe space for our colleagues and peers in the
And just
there
I
are
wanted to add,
yes,
sorry, is it okay? Can I?
No, it's absolutely fine. It's just that there are a bunch of questions, so I'd like to ask those questions from the
I just want to make this point and then we can switch over. So very often we talk about the safe space and it's so vague that we don't know how to provide it. And I think it's important definitely to invest some time and energy into kind of learning about it and getting trained. But apart from that, the other point I want to make is that when people are experiencing depression and anxiety, as peers and managers, sometimes the easiest thing you can do is not solve the immediate problem, but take other problems off their desk, right? I think simple things like you're very upset today and you're having a low day, and you're not able to concentrate. Can you provide a little cabin space where you're able to do some focus work, right? Can you we know that depression and anxiety has an effect on cognition, attention, memory. Are there tools that you can suggest to the person that help them with their work, right? that will actually encourage them to do better work in a better quality and not focus on the problem. If you don't have the ability to solve the problem that they're going through emotionally, you don't have to. It's not,
So help them feel less overwhelmed is what I hear you say.
less overwhelmed.
Help them also to not see themselves as the problem. Help them to see that it is something that they are going through, rather than them being the problem in that. And like Prakash saying,
that's a very beautiful point. Thank you.
Redistribute that workload. Let's get something off the table.
Right. Okay. Yeah, I'm going to take up some of the questions that are there in the question box. Yeah. One person has said that they have a really low ability to deal with stress, get stressed very easily. Is there any way I can increase this threshold? Can you offer some tips?
I
think it's
missed
important.
the question. Can you repeat that? Sorry.
Sorry. Okay. This person has a very low threshold for stress. Any way to increase that?
Okay.
Isn't it important to also understand what are the other things in that bucket which are also filling it up? Is it just the low threshold for stress? Are you just seeing the top, this, and ignoring what are the other stressors that we're also facing? Sometimes it could be as simple as, am I going to a salad bar and I love everything on display there, but I'm given a small tea saucer? How do I fill it up? I can fill it all up like that, but either the plate is going to break or it's all going to fall. Knowing what I can do, seeing instead of what I can't, can I start seeing what I am already accomplishing? With maybe, like you said, it's difficult. I may get overwhelmed quickly. I may have a lower stress tolerance, but what all am I also managing with all of this? Let's not focus on what I can't. Let's focus on what I already am also doing.
Could you? Thank you. I think that's useful for me as well. Could you tell why is it that thoughts stick to you more and more, and then you keep thinking about it, and it goes into a continuous loop? Why does that happen? Is the question. Titus?
Yeah. Okay. Maybe I don't have a direct answer to that, but why do thoughts go over and over? I think when we feel anxious and we tend to think about worst case scenarios in our head, right? It's natural for us to think about multiple things, and try to figure out, is everything in place? I think first thing, it's natural to think about all of those things, but when it gets really overwhelming, that's when it's an issue, and that when you're not able to put an end to it and then focus on something else, that's when it's an issue. Just as a kind of a single event where you're thinking about different things, that's not a problem, because we all tend to do it. But when you're not able to do other things because you have a trail of thoughts, that's when it's a problem. Was the question on how to what to do about it?
Why does this happen?
Okay, the causation behind it.
Yeah, maybe we can look at what emotion is being brought about by that particular thought.
By that, yeah.
What exactly is that thought doing to me? Where is it stemming from? What am I feeling with that thought? Am I just anyway stressed? So just for example, okay, if I'm anyway stressed, then any other thought where I feel that things are not being done would increase that stress, and they would just remain there. It also builds into this cycle of stress, it becomes this vicious cycle where I keep going round and round and round in the same situation, with the same thoughts.
So there was something I read recently about this, which maybe it's apt to share at this point. I believe the Stanford Mental Health and Wellness Center, they used high definition MRIs really to characterize different types of sort of short circuits that happen in the brain when we experience persistent negative stress that we feel we can't control. And one of those little short circuits that happened was just this rumination, just going round and round on the same negative thoughts. And what I read there was that understanding the thoughts, the emotions, and the patterns associated with that same negative thoughts will help us understand what are the times and the scenarios that we're struggling the most, and then what actions can we take to help manage our anxiety in that time. Right? Does that make sense, both of you?
We all want a solution, right? But we want a solution without understanding the problem.
Yeah, so
What we're basically saying is understand the problem, understand what is happening, so that from there I can build.
Right. So somebody's asked, is fear a symptom of anxiety?
I think fear is very normal. I think fear is very normal for all of us. I'll be very honest. When I came up here, I was also a little scared. I was nervous, for sure. Fear, again, what is it doing? Fear is also a very biological response. It tells us, hey, there's something wrong. Be cautious. Let me give you an example.
If fear paralyzes you and prevents you from turning up at this panel, then there's a problem.
Then there's a problem. Exactly.
That's very well put. Yeah. Okay. But also, if it does happen just once, that's fine. But again, if it just continues and persists over time, I think that's an issue. Yeah.
Intensity, what it does to me, what are my responses from it, what is it preventing me from doing, all of those would have to be taken into consideration before we say that, hey, is it going beyond a certain level?
Yeah. So there is somebody who says something similar, and I think, to the person who asked this question, I would probably refer to the same answers that we've given, that the panel's given just now. And that question was, sometimes I think a lot about the future. What will happen? What if everything goes downhill? What if the worst thing I ever imagined comes true? This gives me a lot of stress. How can I control my thoughts to stay in the present? No matter what I do, my sense of imagination just keeps giving me a tough time. That's what she said.
You cannot control your thoughts. Please understand that. I want everybody here to just try this. Okay, whatever you do, please do not think of a green and orange polka dotted dog. Do not think of a green and orange polka dotted dog. Have you ever seen a green and orange polka dotted dog? No, but right
now I do in my head.
You do. You can't control a thought. Don't try and control it. Sometimes also that, now to get rid of that thought, what have we done? We've just let it flow. Sometimes we try to control something which keeps it active in memory. And that too then it's taking up space, right? It's taking up space in your memory, it's taking up energy, it's taking up a lot. So all of that too can be very, very tricky. It's not about control here. Again, it comes back to understanding what it's doing to me, and from there building outward.
So Titus, question for you. Somebody who wants to understand stress and anxiety, is it prevailing only in urban areas like tier 1 and tier 2 cities? Since you have experience with rural, mental health in rural areas, perhaps you could, is this a generalization that urban areas have higher stress and anxiety?
Yeah, I do believe it's a generalization only because I think we all experience anxiety and depression, and I think when it especially comes to rural areas and poverty-ridden areas, I don't want to say all rural areas are poverty-ridden areas, but when it comes to places that are low resourced, actually anxiety and depression have a much more higher prevalence. The difference is that it presents itself in different ways. Somebody in an urban area, because of their knowledge and awareness, may talk about it as anxiety and depression. But when people in a rural area might express it, they might be talking about issues related to basic needs, right? They'll be like, I don't have a job, and that's stressing me out. That's giving me a lot of tension. And that's the way it would pan out. They're not going to talk about it in terms of symptoms. They're not going to talk about it in terms of how we express it, but they will say that they usually use very common terms like tension, chinta, stress, ye sab hota hai mere saath, right? But they won't describe it as a symptomology, but they will describe it as issues of living, which is a lack of a job, or issues related to finances or a loan or things like that. So that's how they would represent it. To answer the question, definitely no, the prevalence is not higher in cities. I think it just presents itself in different ways.
Could I also add that stigma could also
Yes,
play a
please.
major role in the amount of people as they come out? Maybe somewhere stigma too plays a role in my ability to be able to come out. Now, in a village area, maybe a person may not be able to come out and openly say it because of the situation around. How is a person going to look at them? Again, coming back to even the idea about, so what was that? That being a man or being a woman, you're not supposed to feel this. You're not supposed to do this. You're
Yes,
not supposed to be a certain thing. These are socializations that we've all gone through. And those also play a very, very major role with the stigma in actually opening up about.
Thank you. There are a couple of questions from people who are undergoing some challenges at the moment. So there's one person who's been on medication for depression for about a year now, but he's still not out of it. Wanting to know, do you think I need counseling? It's all going to get fixed by medicines only, is the question. So how, as professionals, what advice would you give somebody like that? Because there are 2-3 people like that who are asking for similar things. What do I do? There's a lot of medication, but the situation is still there, things like that.
It's a little difficult to say exactly what a person should be doing here, but let's look at it in this way. If I'm feeling something, if I'm feeling that maybe just talking it out in a safe space, a non-judgmental space, and here this is where I'm talking about that could actually work, then maybe if you feel that you would like to try it out, there's nothing wrong with it. As far as medication is concerned, look, you'll have to consult the doctor itself. You don't just shift medications or stop certain things directly without asking. Consult them. Talk to them about what your concerns are, what you're feeling as well. But in general, let's put it this way: if something is happening that I feel I'm overwhelmed by it, and it's happening more than just once, it's something which is now causing some kind of impairment, not even 100%, just even significant amount of impairment to myself, then maybe searching for help of any kind would not be a problem.
Thank you, Daniel. There's a person who's asking, how do you handle somebody who keeps saying that he or she will commit suicide? So how do if they keep threatening this, how seriously do we take it? What do we do?
Okay. Would you like maybe I can try and answer this. So I think first things first, when it comes to suicide, I think one thing that we need to understand is that if somebody is talking about suicide, we do need to take it seriously. People very rarely talk about suicide casually, right? It's not something that we throw around, just to kind of do something or just to talk about it. When people do express distress, one of the ways they express it, extreme distress, one of the ways they express it is by saying that they have thoughts about killing themselves or they are going to kill themselves. And that's, as a caregiver or a close friend, that's extremely difficult to hear. You're frightened, you don't know what to do. You're kind of spiraling, thinking, if I don't know what to do, can I do anything? Even if, I tell someone, how will that play out? Will that have an effect on me? Will that have an effect on my family? All of these questions are definitely spiraling. So I fully understand that it's a complicated situation to address. But at the same time, it's definitely important to understand that you do need to ask the person to seek help. You need to encourage it, and you need to be supportive in that process to get the person to seek help. Because talking to the person definitely will help. But if the person does, after having kind of supported them, provided an understanding and safe space, still continues to talk about it, and it doesn't seem to be going away, it is something that that would help if you did in conjunction with professionals, and that will also help you feel more empowered, because you feel like there's a team behind you now to help you deal with this distress, and you're not in it alone. So yeah, I fully understand that it's a complicated issue, but it would help if you took the help of someone close to you.
Exactly.
I'll
Whenever
answer
there's
both
Something to
parts of the
add,
question.
Danish?
Yeah.
Danish, would you have
Whenever there's
something
something
to add
like
to
this,
that?
we definitely do not take it as, you're just saying it for the sake of saying it. Do not look at it as attention seeking. See, by doing that, sometimes what is really true, the person may not be openly saying the true feelings behind that. But by saying that it's attention seeking, or you're removing the validity of their own emotions. And that itself can be very, very distressing. If a person is talking about it, please encourage them to seek help.
Yeah, thank you. I think that taking it seriously and advising them to seek help is the takeaway. I think there would be a number of us who have, similar dilemmas. How seriously do I take this? So thank you for that. There are a couple of questions about people who are having trouble at work or in their current situations. Disturbed sleep, nightmares due to work-related issues. There's a person who's asked about his room has been his safe space till now, but of late he's been finding that he can't be in that room without feeling, anxious about it. So, what do I do?
I think that also is something which most of us are feeling, right? Our own bedrooms have become our office spaces. We have meetings in it. Sometimes we eat in it. We have lunch, dinner there, and we are at the desk working. That safe space, that privacy which I used to get, I may no longer feel it. Is it possible sometimes to move a situation out of that? Is it possible to keep my bedroom my bedroom? I know it's not possible always. I know there are constraints. But if possible, can it happen that maybe we shift out of that safe space to, let's say, another room? If I have a work call, or if I have something urgent where I need a lot of space or I need peace and quiet, I can come back there. But if I'm working otherwise, is it possible to work at the dining table? Is it possible for me to move around? Sometimes just these shifts in spaces can also help. As far as sleep and all that is concerned, I think, because again of the workload and everything, the stressors and that sedentary lifestyle, there's no exercise. Like Titus was talking about how important something like exercise really is. Also habits. The simple thing is a routine. When do I wake up? When do I have breakfast? Having lunch at a fixed time, dinner at a fixed time, sleeping at a fixed time, reducing my screen content. If I sit and stare at the screen till 1 in the morning, I'm not going to be able to get sleep. Sometimes following certain sleep hygiene patterns, which could be as basic as even shutting off screen earlier, maybe about 8:39 if possible. Reducing any kind of caffeinated or any stimulants at night. So maybe at 4:35 having your last cup of coffee or tea. Having your dinner well on time, going for exercises, keeping the bedroom itself for only again sleep. All of that also does or could also help in this situation too. If it becomes too much, I would still say talk to someone, talk to people, seek guidance, learn a little bit from
All right. Thank you. The people who have expressed physical symptoms like acid reflux, shaking of their, limbs. So, can we confirm that this could be signs of stress, and that perhaps they should see a doctor about it? Make sure that it's not a physical problem. First, what would be your advice?
I heard parts of it, but if I were to repeat the question, I think people are asking about experiences of acid reflux and other symptoms like shaking of hands, and wondering whether that is related to stress or is it something else,
Yes.
right?
Yes,
Okay,
that's
I think
the
when we talk about any mental health condition, first of all, let me answer the question. Anxiety does affect stomach. It does bring about acid reflux. It is one symptom. Your shaking hands, breathlessness, these are all symptoms of anxiety. But I think with every mental health professional, what we first do is we rule out any other physical health causes before we jump to the tag of a mental health problem, right? So acid reflux could be just acid reflux, a physiological symptom of a physiological problem, and it doesn't necessarily have to be a mental health concern. But do rule out the physiological aspect of it with your general practitioner, with your family doctor. And if they have kind of said that, we have checked everything out and, there's no other underlying causes, then you could start thinking about whether it is, affecting you because of stress.
Hmm. Right. Um, will someone who has had depression get it again? And if it is something that is likely to keep recurring, what can be done to prevent this? Danesh?
It's like a fever, right? It's like a fever, isn't it? Once you have a fever, you get it again. The point is also about recognizing it, seeing what it is doing, catching it early. Whenever we go through maybe depression, it's sometimes very difficult for us to differentiate. Like we saw, right? It's symptoms which seem so normal. So we keep pushing. I think when you go through it once, you may be able to see signs, you may be able to see symptomatology, you may be able to see patterns in maybe behavior or thoughts, which could tell us that, okay, maybe this is a tougher period which is there. Can it recur? Again, there is no guarantee that anything is going to completely stop. With therapy, especially if you're looking at it, we learn more tools. We learn better ways of coping, which could help us to come out of situations or recognize situations better.
Yeah, and just to add to that, I think in general, I think the vast majority of people who experience a depression will experience it once and kind of move through it and not experience it again with the right kind of support. But very often, research indicates that there's about 10 to 15% of people who will have chronic depression and who will continue to experience those symptoms of depression. And I think it's important to figure out with your mental health professional what kind of depression you are experiencing, and that happens through multiple conversations, but both of those do exist. And I do want to bring in this one thing that I missed talking about when we spoke about the workspace earlier. I think when it comes to people experiencing recurrent depression, I think workspaces can be a very therapeutic space for people if we provide the right kind of recovery options when they come back to work after an episode of depression. If we are able to understand the depression well enough and provide the right kind of support, and if the person who's experiencing those recurrent bouts of expression can look at the workspace and say, I'm going to go back there, they're not going to judge me, they're going to be there for me, they're going to support me through this, then it actually opens up a very beautiful recovery option and a recovery space for people experiencing long-term depression.
Thank you, Titus. There's a question that's a little different here. Can you please throw some light on the relationship between OCD and depression? Is there a relationship, and what is it?
Yes, there can be, because first let me say OCD again, for everybody out there, it's obsessive compulsive disorder, and I'll try and break that down into just as quickly as possible, where there could be certain obsessions, which could be thoughts, images, anything repetitive which keeps coming into my head over and over again, which causes me to feel very, very stressed or anxious. And a compulsion, which is something that I have to do, think, or certain patterns of behavior or thought that I have to continuously do to reduce that anxiety. Is there a link between the two? There can be. Again, understand that every one of us, when we want to work, when we want to do something different, we want to change, we try, we put in effort. We push all our resources into getting out of a certain situation. And sometimes it becomes difficult to actually reach that particular goal of coming out. When I'm unable to reach that goal, there can be that it will happen that I start to feel a little dejected. I start to feel maybe that whatever I'm doing is not really helping. It could lead to you feeling definitely low. It could lead you to feel less motivated than before. It definitely could happen. There could be a definite.
Thank you. I think again, there is this the spectrum, the continuum, the overlaps, all of that, which are too complex really to bring up here in this forum, right? One last thing around. There are more questions, but I'm just trying to pick ones where we have not answered, anything in that area. There are several things around the EAPs that the employee assistance programs in organizations may be there, but people don't reach out to them. So they hesitate to reach out to the employee assistance program. So how can we help to break that stigma of getting them to even reach out to the EAP?
Okay. Okay, I think that's a great question, and I think EAP is something that we've been talking about, and I've been hearing through a lot of the conversations in this forum. And you're absolutely right. I think whoever's asked the question, I think there is a gap between providing a service and accessing it, and the biggest barrier to that is stigma. And I think there are other barriers also, but the biggest barrier to it, I feel, is stigma. If you create an environment in your organization where it's easy to talk about this, and I can give you a few things that people can do. If there are people who have used the AP service and can share stories even anonymously without their name, and you're able to capture that and share that with people, it empowers people. Those stories have the power to really empower people. And I think when you hear lived experiences and hear lived experiences in those stories, I think it really gives other people the the strength to say, hey, even I'm going through this and I wouldn't mind trying this out. So share stories if possible, and if it's difficult to do it with names, share it anonymously. The other bit, I think me and Danish were talking about this over a call, was make it easy to access help. So when I say easy is all of us working in organizations know if our laptop crashes, we know the IT person or the IT email to call, or kind of say, hey, listen, I need help fixing this particular bug, right? Or I need help with this particular app because your work won't function without it. It needs to be as simple as accessing, IT support. You need to simplify the process. It needs to be as simple as putting your name in and just submitting something that's available on your screen. If it is made simple, people will use it and will at least try to use it. So reducing stigma and simplicity can go a long way in improving it.
Again, just putting it next, if you are someone who has to log in into your screen, maybe again on the login page, can I just have a small box to the side which talks about this? So it's always there as a reminder that, what, we have help. It's available. You never know when that small box could be very useful to someone.
Thank you. Now I'm just looking at some of the other questions. So when somebody suggested that their friend seeks help, the person said, do you think I'm mad? When she suggested that they seek help. She's saying that, but your answer helped us. So she's saying, thank you. So how do you get people to still continue to work productively? Yeah, the workload keeps increasing for everybody. If somebody is depressed and the stigma is still there in the workplace, how do you do it without sending a message that the person is not trying to escape from work or being lazy, like you said earlier, without giving those labels?
Again, I guess that is where you have a safe environment. Sorry.
No, I was just trying to understand the question. This is from the perspective of the person who's experiencing depression, right?
No, this is a question from somebody who says somebody else is depressed. And how do you convey this?
Yeah, okay. Go ahead, Danish.
How do you convey
Are
the
there
issues that I
accommodations?
have at the workplace, other issues that are there, to somebody who's depressed, but the work still needs to be done?
Right.
That's the question.
But again, what we're also doing here, if we say that, look, work needs to be done, so it doesn't matter, you have to do it, we're putting the onus of responsibility on that one person. Is it possible again to divide that work? Is it possible to actually change and renegotiate around that?
Yeah. And
Okay, I think this is something that you're reinforcing, which what you said earlier.
Yeah, I think adding on to Danish's point, I think there is a difference when we talk to people with, I speak to clients about this. There's a difference between responsibility and accountability, right? We definitely can hold the person accountable for tasks that they have said that they would deliver on, right? But I think when we talk about responsibility, the responsibility lies with the whole system when it comes to a task or work. When it starts with the design of the task, it starts with how the task is broken up, it goes on to how well it's planned, and it fits into how well it's executed. The work definitely needs to be done, and it's completely okay to hold somebody accountable for the fact that the work was not done, but you can still be empathetic about it. You can still understand the other environmental factors that play into the reason why the tasks were not done, and you can still do it in an empathetic way. You don't have to kind of say, oh,
so
it's okay.
Provide the safe space is what both of you are saying, is provide that safe space.
Yeah,
right?
yeah.
We're actually run out of time, and there are still questions. So my apologies to those whose questions have not been answered, but I did try to pick out the ones that most number of people had asked, and I'm hoping that the majority of questions have been answered. Thank you both very much, Danish and Titus. I don't think 1.5 hours is enough to do justice to the kind of questions that people have around this topic. But if we have triggered a thought process, and if we have triggered people into thinking what needs to be done for themselves as well as for people around them, I think that's really what we had set out to achieve. So I hope that has happened. Thank you both very much for giving your time. It's been really useful for all of us.
Thank you, Devika, and thank you everyone for listening in. It was a pleasure.
Nisha, over to you.
Thank you so much. Wow, what an insightful, freewheeling discussion. I must say kudos to all three of you. Devika ji, for having conducted the discussion so well. There was a flurry of questions I saw, and a lot of it we to address. Thank you very much, Danish and Titus. Very practical, simply explained, points that all of us had takeaways from. So grateful thanks to you. As we conclude, shall I just quickly take you through what else we have in store for you as part of the Mind Matters initiative? Do sign in to this story sharing later in the evening today, in about an hour from now. Melna, her story on resilience is what is going to be presented. Do ensure that you sign up and witness what she has to say and share with all of us. Earlier in the day, we had gone through these sessions on musical mindfulness. There was a general mental health awareness session, and we also had a panel of best practices from these very reputed brands in the country. And here is a glimpse again of what the calendar looks like for today evening, tomorrow, and day after. Special mention of the tweet quiz coming up on Saturday morning. We urge you all to participate and win prizes for being the fastest one to answer all 3 questions correctly. A special word of thanks to all our partners who have made this entire initiative possible. We are indebted to you, knowledge partner, White Swan Foundation, academic partner, TIS, learning partner, LinkedIn Learning, and of course, our entire design and communication partner, which is Fulki. Do visit our website, nationalhrd.org, and consider becoming a member to stay tuned into all our various offerings. Do tag us on social media. Our handle is @NHRDN and #NHRDN Mind Matters. We trust you would have shared your feedback with us. It's very important that we know what you thought of the entire discussion and all the various offerings we've brought for you over the past week and in the couple of days to follow. Thank you all. Stay safe, and we look forward to your participation in the subsequent programs. Thank you again. Bye-bye.
Thank you. Thank you.
Thank you. Take care.
Thank you. Take care.